Tell me a little bit about the thickness. What's the required final thickness of the zirconia prosthesis? And I'm not a clinical person, so if something wrong, forgive me.
Yeah, no worries. You're talking about the All-On-4. That's some of the complex implants cases that we do. One of the biggest challenges is making sure we have the proper thickness for strength. And that thickness should be between 12 and 15 millimeters minimum, and that's from the crest of the ridge to the incisal edge of the prosthesis. That's a must. It has to happen, or otherwise you'll get breakage. Zirconia does break, despite what people will tell you. I'm sure we all know that now, although that's the way it was pitched early on. One of the ways to get that thickness for the restoration is, of course, bone reduction is the first choice. This is a surgery type of restoration. The bone needs to be reduced, and that's the first choice. And one of the main reasons for that is strength, but also for the ridge. Underneath the ridge, it can't be convex. It can't be concave. It has to be convex, and that's for cleansability. Patient has to be able to get underneath there and clean, so they have proper hygiene. And so bone reduction aids in that. Because it doesn't turn into a ridge lap type of situation. We can make it nice and cleansable and clean. Sometimes that minimum thickness can be achieved by opening the vertical a little bit. So if the patient can tolerate it, the vertical can be opened, of course, and you can attain that thickness. So that's kind of a fallback position to be in. Bottom line, though, if you get down to where you're less than 12 millimeters of thickness, a titanium bar would be the way to go. It's a substructure that we built inside of that zirconia. And of course, these are full mouth restorations. It's a full upper arch. So that titanium bar would be placed in there to add that additional strength if it starts to get down to that thickness. Of course, is more complicated. It requires more steps and more expense. So bone reduction is the first choice to be able to solve that problem. And that gets you to that thickness that you're looking for.